Good, beautiful Sunday, everyone. Welcome to another episode of the HR Cafe, Usapang Trabaho, Buhay, Iba Pa. We're at episode 72. Today is December 12, and we are again meeting each other for another weekly weekend of learning. So, our topic for today is about the importance of mental health programs in the workplace. And our guest will be no other than Mr. Raphael Santos, who's actually the mental health lead of MedGrocer. But before that, of course, let's start with our program with the introduction of what is the HR Cafe. So, ladies and gentlemen, audience and listeners, the HR Cafe Trabaho Buhay Iba Pa is an online talk show program sponsored by the Philippines HR Group, and this is aired every Sunday at 3 p.m. We've been in broadcast since the start of the pandemic, and today we're at episode 72. My name is Coach Darwin Rivers. I am the founder and president of the Philippines HR Group. I'm a certified life coach, public speaker, and motivational speaker, as well as an HR consultant. I am working right now as the VP for Global HR Operations in a BPO company. Together with me are HR Cafe servers, namely Mentor John Bernard Ordonez Caasi, Mentors Ronaldale Ferentino, and also Mentors Tina Coan. Unfortunately, Mentors Rona, Mentors Tina, and Mentor Burns won't be able to join us today because of very important engagements. But of course, expect them again on our next episode. Now, for all of you guys who are just new and tuning in to our program, I would like to welcome you to the HR Cafe. Here at the HR Cafe, we provide timely news and updates. We impart knowledge and experience that are value adding and beneficial to you, our listeners, and our audience. We discuss problems, issues, and challenges, and also provide answers and resolutions with the help of our guest speakers. If there are new technologies, new tools, and processes, we also discuss them because here at the program, we would like to impart industry's best practices. If your company is hiring, please make sure to mention it at the comment section and we'll be happy to announce it because here at the HR Cafe, we're also a virtual job board and we would like to connect employees or possible employees to their prospective employers. At the end of the day, the mission of the HR Cafe is to bridge understanding between employers and employees and provide inspiration and motivation to the Filipino working professional. Join me in another episode today of the HR Cafe, Usapang Trabaho, Buhay at Iba Pa. For all of you guys who has been supporting our program ever since, you know that we started with a wow quote for the week. And for this week's wow quote for the week, we would have a quote coming from Mr. Russell Wilson. According to Russell Wilson, if we start being honest about our pain, our anger, and our shortcomings, instead of pretending that they don't exist, then maybe we'll leave the world a better place than we found it. Let me repeat this quote for the week. If we start being honest about our pain, our anger, and our shortcomings, instead of pretending that they don't exist, then maybe we'll leave the world a better place than we found it. This is a quote from Mr. Russell Wilson. Dear viewers, dear listeners, how does this particular quote resonates to you? Please share it at the comment section and I'll be happy to read it and share it to our audience. Please make sure that you mention your name, your company, or of course, the geography where you are at. Okay? Now, let me start on my opinion or about my thoughts about this well quote for the week. I always believe that as an HR professional, as a certified life coach, we should always be honest to ourselves. And when I say being honest to ourselves, it means that we are being honest on how we feel. Most of the times, whenever we are engaging or whenever we are uh, um, discussing with people, whenever we're engaging with different sets of groups, we tend to what? We tend to, of course, show our best in every time that we are engaging with different types of people. But you know what? One of the things that I've learned in life is that you just have to be honest with yourself. If you feel that you are in pain, if you feel that you're irritated, if you feel that you're angry, if you feel that there's something that is bothering you, speak up and tell the person. You don't have to if you're angry, you don't have to be angry with people, because normally we're not angry with people, we're angry at the situation. And you don't have to raise your voice, you don't have to shout, you don't have to make unnecessary things. You just have to be honest and tell the person what you're actually feeling. Friend, I am not feeling well today. Friend, what you've just said hurt me. Friend, what you've just did actually hurt me or made me uncomfortable. Be honest with yourself and the people that you are engaging with. Either they are either they are your office mates, your family members, or your friends. Because being transparent and honest with yourself actually not only helps the person understand what you're really feeling, but also it has a effect in your whole well-being. You know what? According to research, most of the dreaded diseases are because of unkept emotions or emotions that are negative, but we are not able to express it. And what it does to our body is it lowers our immune system. It lowers our ability to understand, our ability to take care of our body, our ability to be able to be free of all the negative thoughts. Remember, if we have this negative emotional uh, burden in you, what happens? It makes you sleepless. It makes you it makes you unfocused. It makes you lose meals. It makes you do things that normally you should not be doing. So being able to always be honest with whatever you're feeling and just verbalize it and make the person understand how he or she will be able to help you is a good thing. Um, Even at work, if you feel that your colleagues or your boss put you into a spot, and you feel you're sad about it, you're lonely about it, what's the best thing to do? Talk to your colleague, talk to your office mates, share to them your feelings. But make sure that if you're sharing this stuff, share it to the people who is part of your circle of trust. Because if people that are part of your circle of trust are the people who would understand you. You just have to vent it out. Again, being transparent with your emotions is very important. And according to Russell Wilson, if we just be honest with ourselves and with our emotions, then maybe we'll leave the world a better place for everyone. So that's it for the wow quote for the week. Now let's go to the HR question for the week. So, as you know, December 1 was the start of the vaccination mandate here in the Philippines. And in relation to the IATF resolution, uh, for those employees who will be working on site should be fully vaccinated or at least partially vaccinated. And for those who are not vaccinated, they need to undergo RT-PCR tests to be able to work on site. There's also a Department of Health and DOLE advisory that encourages employers to ensure that their employees are vaccinated. And as you've known, we have had multiple uh, um, vaccination programs with different LGUs and, of course, with different companies. Now, there was a question in the HR forum. Should employers give out a vaccination leave to support the vaccination mandate of the PH government? Because basically, let's say you have an unvaccinated employee, or let's say a person needs to get his or her booster shots and it's scheduled on a working day. As per DOLE and for DOH, that person should be excused. And according to DOLE, when they say it's that employee should be excused for being vaccinated that day, it means that the person should be paid in full. So employers are asking, should the employee be using their leave credits for this? You know what? The advisory of DOLE is silent on it. Nevertheless, what I would suggest is try to create an internal memorandum in your company wherein you provide employees a vaccination leave specific for COVID-19. So, whenever an employee or an unvaccinated employee needs to take his or her vaccination, COVID vaccine vaccination, or booster shot, then have the person applied for a vaccination leave. No need for the person to ask him or her to use up his or her earned leave credits. But again, the advisor of DOLE is silent on that. Actually, companies can actually encourage employees to either use their leave credits or put it on a no work, no pay. But as per DOLE, if it's a scheduled vaccination day, then the employee should be paid. So employers have no recourse but to ensure that if the employee is scheduled for vaccination, then employee is excused and is paid for that day. So my advice, create a internal policy specific for the vaccination leave for COVID-19 and also include the booster shots so that it will not only encourage your employees to complete their vaccination and complete their booster, it also encourage um, confidence with your clients, with your customers, that your people are all vaccinated and are safe. Okay? Now, we would like to go to our discussions with regards to the topic today, which is mental health. So let me just jump into mentioning our sponsors for today. So we have El Puerto Marina Beach Resort and Vacation Club. El Puerto Marina Beach Resort and Vacation Club has resorts and hotels in Pangasinan, in Boracay, and in Coron, Palawan. If you are a member of the Philippines HR Group, you get special discounts and special promotions. So make sure that you reach out to their FB page, El Puerto Marina Beach Resort and Vacation Club, and mention that you're a member of the Philippines HR Group or the HR Cafe Usapang Trabaho, Buhay, Iba Pa, to get your discounts. If your company is also looking for a virtual HR certification program, the Philippines HR Group partners with People Matters. And this is with People Matters Singapore and People Matters India. All of our members gets 25% off for all of the virtual certification program of People Matters under the BNext modules. These are certification programs in virtual recruiting and onboarding, virtual performance management, and virtual reimagining of employee experience. They have a lot more virtual HR certification programs. And actually, top Fortune 500 companies in the Asia Pacific, like Unilever, Ligo, Tata Steel, Capgemini, and a lot more, have all already been utilizing the virtual HR certifications of People Matters. So again, if your company is interested, just make sure to reach out to them in their FB page or website and mention that you're a member of the Philippines HR Group. You can use our discount code PHRG25. If your company is looking for an HRM management system, PeopleForce is a cloud-based HRIS management system. And they offer HRIS, People Recruit, which is used in talent recruitment, People Perform in performance management, People Pulse in terms of engagement, and People Time in terms of timekeeping and payroll. If you're interested to know more about their products, about their HR management system, which is cloud-based, please reach out to the FB page of People Force or People Force HRM in Facebook and inform them that you're a member of the Philippines HR Group, and they would give you a 14 days of free trial to try their product. We also would like to thank MaxiCare for being our sponsors of the Philippines HR Group and the HR Cafe. MaxiCare has two new products right now. It's MaxiCare Prima Silver, which is for individuals up to 59 years of age, and MaxiCare Prima Gold, which is for seniors 60 years old and above. So if you're looking for a healthcare partner or a healthcare program for your company or for your loved ones or family members, the Prima MaxiCare program is actually a postpaid program. So just reach out to www.shop.maxicare.com.ph, and members of the Philippines HR Group get special discounts. Now, if you have any questions with regards to any HR or leadership questions, please post them at the Philippines HR Group. If you're also in LinkedIn, we have a growing community in LinkedIn. In the Philippines HR Group FB page, we're already at 200, almost 262,000 members. Congratulations, everyone. We're looking to end the year with at least 263 or 265,000. But still, we are the largest and most dynamic online community in Facebook. We're also growing in LinkedIn, as I mentioned. Please join us. Just look for the Philippines HR Group in the LinkedIn group page. Also, if you would like to review or watch previous episodes of the HR Cafe Usapang Trabaho, Buhay, Iba Pa, and we have like 71 episodes already, you can watch them at the FB page of the HR Cafe Usapang Trabaho, Buhay, Iba Pa. Please make sure to like and add us up. For sponsorships, if you would like to be a sponsor of the Philippines HR Group activities or the HR Cafe program, please message me, Coach Darwin Rivers, or you can message Mentors Tina, Mentors Burns, or Mentors Rona, or email us at darwinrivers@yahoo.com. So, ladies and gentlemen, we are now going to the most anticipated part of the HR Cafe, and this is the free training program. And as mentioned earlier, our guest for today is no other than a representative from MedGrocer. And he is a millennial, but already a people leader. We will have Mr. Raphael Santos. Mr. Raphael Santos is the mental health program lead of MedGrocer. MedGrocer's corporate mental health program, and they provide mental health and therapy support to over 300,000 employees nationwide. He graduated from the Ateneo de Manila University School of Management. Outside work, Raphael is an amateur home cook and also a fur dad. MedGrocer's online pharmacy clinic management services and patient support programs enable patients and corporations to get their medicines conveniently, cost effectively, and intelligently. To be honest, MedGrocer is a partner of my own company, the company that I am with, Inspiro, and we have been in partnership with them for quite some time now in our vaccination program for our employees and also our clinic management program. So, without further ado, let me welcome Mr. Raphael Santos. Hi, Raphael. Hi, Raf.
Hey, Coach Darwin. How's everyone doing today? Hopefully, you're all sounding out in the comments below. Very happy to be speaking with everyone today. So yeah, as Coach Darwin mentioned, yun nga, I'm currently working with MedGrocer, hoping to share a bit about mental health today. Yeah,
Okay. And I believe that, Ralph, you have a presentation for us, right? With
right.
regards to mental health. So, Ralph, question. Why
Sure.
should companies invest in mental health programs for employees?
Mm. Well, it's a very loaded question, no? And that's primarily the discussion we'll be having throughout this afternoon. But the short answer is there's a lot of return on the amount of investment that you put in your people, right? And I think as HR folks yourselves and the people joining us today, much of you realize that people are the most important part of any company, right?
Okay, then I'll give you the floor, Ralph, and go ahead and start our learning program for today. We have more than 50 people watching you right now, and I'm sure as you go through your presentation, a lot more people will be watching you and learning from your program. So I'll give you the floor, and you can start discussing.
Sure. Thanks so much, Coach Darwin. I actually just want to react then to the wow quote of the week. No, it really struck me as well. Since Russell Wilson was also talking about mental health concerns, no, bottled up emotions inside people. And I think the biggest part in anyone's mental health journey is really accepting things, so we can move forward. No, so that's my piece on that quote. Okay. So sige, let's get started. I know it's a Sunday today. Hopefully everyone's relaxed, having a good Sunday so far with family and friends. And hopefully, naka-retail therapy na rin kayo. I know it's 12:12. So hopefully masaya rin kayo sa mga nabili nyo online. Um, but yeah, today, thank you so much for being with me. I'll be sharing with you a few of our learnings so far as a corporate mental health service provider, and give you some insight on what the landscape of mental health looks like from our perspective, no, as the actual service providers other than employers or people workers as well. Okay? Sige. So to begin, let's go over what questions we're looking at answering today, right? So we're covering the four basic questions, right? Who, what, where, and how. And if you're wondering, saan napunta si Wen? Well, si Wen is right now. We're talking about it right now. So hopefully you get to pick up a few things from these questions. Okay. So let's go over it very briefly. Number one is who in our population needs mental health support? I think a lot of us have trouble identifying sino ba yung makikinabang if ever I do implement a mental health program in my company. That's a clear answer that we'll provide you today. What kind of support do they need? It really depends on a lot of other factors that I think you will be surprised by some of these factors later on as we discuss. Okay, where do we start in creating a program in the first place? Mental health is very new in the Philippines. I think a lot of us, baka 2 years ago lang when the pandemic started, dun nag-ramp up yung hype, so to speak, about mental health. So that's something that we'll also discuss. And of course, the bottom line, magkano ba to? How much do I need to invest to generate returns from my company? How do I take care of the people that I work with? Okay. And disclaimer lang, since we are talking about mental health, we have a lot of data to present you. So sorry, there's going to be a lot of numbers during the first half of this presentation. Don't worry, di ko naman kayo ipapamath. I'll walk you through the slides as much as possible. Yeah. Now, let's go over the right side of my slide. No, now all of these discussion points will be founded on actual data. So this is data that we've collected over the past year that we've been conducting mental health programs. And as you can see by the numbers, we've taken care of over 400,000 employees across the Philippines. So yes, we are a local company. So I believe these insights will also help you get a better understanding of your own workforce and your own employee population. All right. And of course, this is all developed and delivered to our clients by our licensed psychologists and psychiatrists. So all of them do conduct therapy and medication management as well. And all of our clients so far that we're including in the data set that we're presenting with you today has a headcount of over 1,000 people. Okay, so let's keep these things in mind. Let's keep the questions in mind as we go through this presentation. All right, so let's get started. Now, I think a common concern, right, for employers and HR people here in the country is, how do we know ba? Paano ko ba malalaman if my employee or if my colleague is going through a mental illness? And I think that's something that I want to answer at the front of this presentation. Let's clearly identify what is mental health versus mental illness, because those are two generally the same things, but they're actually very different. If we're talking about mental health, you can see the scale in front of you in your screen with severity and the low end and the high end. Mental health covers this in totality. So no matter where you are on this side of the scale, this is all about mental health. But if we're talking about mental illness, let's clarify this as more of clinical definitions and clinical illnesses. Okay, because I know it's hard. Many symptoms of mental illness are struggles well people experience every day too. For example, you might be adjusting to a new job and you might be finding it a bit difficult, getting put into a new environment, right? But if this prolongs and if this difficulty in adjustment persists through time, and also it gives you sort of that anxiety, it's hard to function at work, you're bringing it at home, nilalabas mo to your family. These are things that might progress to a mental illness. Okay? But it's important to note, though, that our goal here today is not to say whether or not who in my employees are malingering. Sino ba yung nagfi-fake na may mental illness sila? Because that's not necessarily for us to judge. That's why we have licensed professionals as well. No? Our primary goal here today is to really paint a better picture, a more accurate picture of what mental health looks like for our companies, and also so we can communicate that better to our employees. So hopefully we're all on the same page there. No? So you might be wondering then, how do I find out if nasa low end ba or nasa high end yung person na to? Well, I'd want to draw parallels or similarities to physical health, right? If you think about physical health, you go to a doctor first in the hospital, okay? That doctor will assess you. Baka mag-prescribe siya ng lab test, papa-CBC ka, urinalysis, to find out if there's anything wrong. Mental health goes through that same process too. So you see maybe a licensed psychologist, they'll give you a few assessments. And if ever, there might also be lab tests involved. So I want to remove sort of that notion na baka haka-haka lang yung mental illness. It's very much real, clear, and identifiable. All right? Sige. So let's move on to the headline. Now, where do we draw the line? But what is that line in the first place? So if you see this line in front of your screen currently, the line that we're hoping to draw is to find out where your company or your organization might be comfortable with supporting. Because for example, okay, sige, we cut off the line at the very high end of mental illness. These are people that might need care at a facility or stay somewhere long term, right? If we draw that line there, then we'd also need to create those support systems for our employees to be able to have access to those facilities. But maybe what we can only cover so far is maybe the middle, right? things that are more on chronic work stress, anger management, and these things might have different interventions that are less long term. Okay? So I know it's a lot to take in right now, but the next few slides hopefully will break things down further and give you a better understanding of mental health and what we can do about it. Okay? To add some more context to our discussion today, I want to share with you a few slides on the demographics of employees that reach out to our mental health services, right? And I just want to again emphasize that this is actual data from Filipino companies and Filipino employees. So this might be something worth taking home into your own companies to do your own assessment as well. Okay. So let's take first a look at age and tenure. So employee age is to the left of your screen and employee tenure is to the right. So when we're talking about tenure, this is about how long an employee has been in your company. And something that isn't quite as surprising is that the population of companies that we work with and that we provide services for are generally younger, more on the millennial age, right? Because these are a bit more progressive companies that already want to cover mental health. So keep this in mind na lang whenever we're discussing the next few numbers. So if age doesn't really say anything in the number of people reaching out for mental health consultations, then let's take a deeper look at company tenure or how long employees have been in your company. I think as HR people, especially when we're doing onboarding, we're welcoming a lot of new people in the company, we're happy that it's growing, we tend to push a lot of services, di ba? Baka may pa-office lunch meals kayo dyan, baka may free bakuna and stuff like that. And while those things are very much welcome in our mental health services, what we want you to focus on is the orange bar to the bottom of your screen. So it's comparing your total employee population versus the population that reaches out for mental health consultations with psychologists or psychiatrists, right? So what you can notice here is that it's actually the more tenured people that are reaching out for these consultations. So these are people that are already beyond that 12-month regularization period or that 6-month regularization period. There might be, diba, a honeymoon period, so the newer employees might not be experiencing as much stress in the workplace because they're happy to be with a new company, or they might be a bit shy to raise their mental health concerns at the moment. But one thing that we know for certain is that we do need to support our tenured employees. Okay? So earlier, I mentioned that we handle over a total population of 400,000 employees across the country. And across all the companies that we serve, more females than males reach out for mental health support. So the right bar takes a look at who's reaching out for mental health support. The left bar is your total employee population. So there might be a bit of a disparity there. So what causes those things, right? This might not be surprising to people here today kasi may stereotypes na tayo of certain genders, right? We'll say na, okay, females, I expect them to talk about mental health more because they're more emotional, for example. Or males don't really like talking about their feelings, so bakit sila pupunta for mental health consultations? And yung LGBTQ population naman natin, they're the happiest people or they're the ones that spread the most joy in our company. So yeah, sige, it makes sense that it's a bit lower for males and the LGBTQ population. But if we take a deeper look at these demographics and we take a look at what their risk levels are when MedGrocer sees them for a consultation. So this is when they lodge a request or they send us a message na, hey, MedGrocer, I need mental health support. We always make an assessment before we send them to a consultation room with one of our psychologists and psychiatrists. These might be measuring depression, anxiety, stress levels, and the like. If you take a look at the first two bars here on your screen, the female and male population, they're generally the same when you look at the risk levels that they're having. We're taking a look currently at high risk and urgent risk cases. So these are the people that are most likely to have clinical illnesses already. So things like clinical depression, clinical anxiety, post-traumatic stress disorder, and the like, right? But what's actually really surprising with the data that we're presenting right now is the LGBTQ plus population. They're the ones who are reaching out to us at a later stage when they're already experiencing maybe severe impairment or medyo nahihirapan na talaga sila sa dinadala nila in their day-to-day lives. So maybe that's something where we can focus on moving forward is, supporting our LGBTQ plus populations even more in the workplace. All right. But don't worry, it's not all bad news naman today. I'd also want to share some good news on our end with our data. The good news is that 72%, or the blue bars here at the bottom of your screen, are people that are reaching out before their issues intensify. So before it's something clinical at all, if it's something more on the low end, if you remember the line that we showed you earlier, our second slide, I believe, it's much better that people are proactive about their mental health, because it's much harder, for example, to treat a condition that's already progressing or in the orange end, versus people that are trying to prevent things from getting bad in the first place. Okay, so let's keep this in mind whenever we're talking with our employees and also discussing mental health in the workplace, right? So, if you noticed recently, we've been talking more and more about mental health. I think in the past 1 year, siguro, I believe that you HR people have probably attended more than two or so mental health webinars for your workplace, right? So, bakit ba nauso si mental health? Well, COVID definitely played a big factor in that, right? Even the psychology community, they were worried that okay, people's mental health sasamayan during the pandemic because we're all working from home, we're all locked down. There's nothing we can do, no social interaction, right? But now that we're hopefully seeing the end of the tunnel when it comes to COVID, and some other countries have already fought the battle with COVID, we're seeing new data come out, especially from global data, that the mental health levels of people pre-pandemic, so before nangyari si COVID, and after COVID, or for countries that have already vaccinated a large part of their population, it's actually returning to normal already. So it did not have that many lasting effects on the mental health condition of people. So what happened? Why are we seeing so many people reaching out for mental health support? Well, if you take a look at this graph and the colors it represents, a lot of the people are raising concerns on personal reasons, right? These might be people that have already had underlying mental illness before the pandemic even started. And it might have been aggravated by a few factors, no? Baka yung family pala nila yung nagtitrigger sa kanila. So they're spending a lot more time with their families, then of course your mental health might deteriorate then. Okay? But something that's also interesting is work during this pandemic. A lot of us faced a lot of changes with work, right? A lot of us are working from home. We're not on site anymore. So there's a major shift there too. But work's only making up around 22% of the entire population that's raising concerns with MedGrocer. So it's sort of weird, diba? Because what you'd expect is papasok ka to work and then yung work dinadala mo sa bahay and might cause problems at home. But here in the Philippines, it's actually the reverse, right? It's our personal concerns that's affecting our work. So that's something to keep in mind then. Helping people's mental health and making sure they're okay at home will, of course, make them more productive at work. Okay? So a few other lasting effects of COVID that happened because of this greater awareness nga, as the first bullet says on mental health. Teleconsults or consultations that happen online, of course, it's very hard for us right now to get to a hospital or look for a psychologist, look for a psychiatrist. Even if you ask people on the street, for example, uy, saan ako pwede makahanap ng psychologist? They might look at you in a weird way, diba? It's hard to look for a psychologist and psychiatrist that you trust. But the thing that teleconsults or online consultations has allowed us to do is to do that work for you. So if ever you're seeing someone from MedGrocer, for example, you can be assured that these are people that have been background checked. These have been people that have a track record of good service whenever it comes to consultations. So it removes that friction from needing to find a mental health professional yourself. So that's why it's also really important that technology is playing a role in increasing the capacity of mental health services in the country. I think if you're aware also, there's only around one mental health service provider for every 100,000 people here in the country. So mahirap talaga siya. It's hard to get access to these licensed mental health professionals. And that's something that teleconsults has helped with. And I think one of the biggest factors as well that's happened throughout this pandemic is HMOs have been more proactive in covering mental health needs and mental health concerns. If before you try to get mental health coverage with your HMO, it might be a bit difficult. There might be no coverage at all, or they might give you a discount. But nowadays, certain HMO providers are covering your mental health needs entirely, from your consultations to medicines, etc. So all of these three factors played a big role in making mental health almost a bigger stage, or giving mental health a bigger stage here in the Philippines. All right. Sige. So if we're taking a look naman at what are the actual diagnoses of the people that reach out to us. So if you remember the last slide, it's about ano yung problema na dinadala nila whenever they visit a consultation room with MedGrocer. This is on the end of our service providers naman, our psychologists and psychiatrists, explaining, okay, you might have this condition and this is something that we'll focus on. Okay? So it's important to note also these two bars are very different, very distinct. Kasi for example, you have your chronic conditions. So for example, sa physical health, baka may diabetes ka, that's something that's more of a chronic condition. And there are also acute conditions. Or ito yung mga dinadala mo usually sa ER. Like for example, malapit na yung bagong taon, so baka nagpapaputok kayo ng fireworks, pag may natamaan, ER yun. That's an acute condition. And for mental health, we have those two very distinct classifications as well. So for more of the chronic conditions or the regular consultations, more people really go through depression, anxiety, trauma and stress related disorders. That's about something that we'd expect, no? But one thing that I'd also want you to focus on is the gray bar on top, or the others. This is more people that are proactively reaching out for support. So these are people without a clinical diagnosis just yet. They might just be being treated for something that's more everyday, and they're being more preventive about their mental health. Now, if we're taking a look at the right side of the bar whenever it comes to emergency consultations, this is where suicide already comes in. But before we proceed further, I just want to issue another trigger warning lang din for the people in the audience. We will be discussing a bit of a heavy topic then today. So whenever it comes to suicide, that's a topic that we always want to heavily emphasize then. All right. So the biggest contributor really to emergency consultations is in relation to suicide. Now, suicide doesn't necessarily come from one cause. No, it's not necessarily depressed ka and then may suicide in that, right? It can come from many mental illnesses. No, so let's not just focus on depression here. But what's important is we want to see that number slowly go down, and then let's move these people back to regular consultations where we can have them treated and be more mentally well, either through therapy or medicines. Okay? Sige. So let's just have a quick checkpoint on where we are currently in our syllabus. No, may pa-syllabus tayo today. In terms of the questions that we've already answered, who in our population may need mental health support? The answer is generally everyone, right, will benefit from having a mental health program in your workplace, but specifically more towards your LGBTQ plus population. We might be able to encourage them a bit more to speak up about mental health related concerns, and see if we can support them better there. Okay. Now, what kind of support do our employees need? Well, if you remember the last slide, it really depends on where you are or where your employees are along that line of severity. If it's more on the low end, more on the high end, They might need different treatments, different interventions to get them better. But what necessarily are these treatments or interventions? We'll get through that a bit later on in our discussion. The last 2 points that we'll be covering for this afternoon and for the next set of slides are where do we start in creating a mental health program? I know it's still something that's pretty new, so it might not be something where we're all familiar with, and it's hard to start a mental health program. So we'll get you started on that. And of course, the biggest question, how much should we budget for a mental health program? So later on, we'll also discuss that. Okay, so a few questions that I'd want to pose to the audience today to ask yourself. You can have an internal discussion by yourself, Muna. Is what should be the mix? It's important also to understand why we use mix. The specific word is because we believe that in creating a sustainable mental health program, it's not a black or white thing. It's not either or. It's not on site or off site only. There might be certain instances where you need certain services to be with your company. All right. So, what should be the mix of on site and off site services? So, for example, si Coach Darwin, he's already returning on site. I believe some BPOs are already working on site. So, they also need things like clinic management, vaccinations, etc. In mental health, there's also that need, no, for some companies. They might have certain programs that are more heavily monitored when it comes to mental health, and it might be beneficial for a licensed psychologist, for example, to also be on site with your employees. So it's also finding out about that mix. Comparing your in-house management and vendor involvement, right? How much does your HR want to take on the shoulders of mental health support? There are other companies that we work with, for example, that actually train coaches internally in their company that also takes care of employee mental health. So maybe if they're facing work concerns, they're having a hard time adjusting to work, that goes through a coach first within the company before they reach out to a vendor for mental health support. So that might be something that you would want to consider integrating into your own workforce as well. Now, whenever we're talking about vendors, there's always a mix between the number of volunteers or unlicensed professionals. These might be people, for example, that are just taking up master's degrees in psychology and things like that, versus actual licensed mental health professionals that can diagnose and treat. So these are your psychologists for therapy, your psychiatrists for medicines, and for example, certified life coaches like Coach Darwin. They're also part of this mental health ecosystem, right? So that's also a consideration that you might want to think about. And of course, the last, whenever we're talking about budgeting and how much should we spend, of course, there's always that argument versus what can I cover for free as a company and what can I only subsidize costs on. There are certain things whenever we're making mental health programs that we can subsidize as well. So, for example, medicines might be something that you'd want to subsidize instead of fully covering all of the medicines that your employees might need, or something more related to consultations. Maybe you can do 3 consultations for free, and then the following consultations with psychologists might be shouldered by your employees. So there are a lot of things that you can play around with to integrate mental health programs in your workplace. Okay? So, sige, let's talk about what a sample mental health program looks like. So, something that we always start with are our first line interventions or the bottom of this pyramid. You might ask, why are we structuring it in a pyramid way? Well, something that we also believe in and something that we want to emphasize is it's hard to build to the top of that pyramid than sa tertiary interventions if you don't have the baseline established just yet. So ano ba yung examples of first line interventions? Things like webinars and things that you run for your employees. Maybe it's more on assessments to check if they're doing okay. You might do a monthly service or a monthly survey with your employees to check in on if they're doing okay at home. There might be something that you can do about that. Now, when we're moving up the pyramid, it gets closer and closer to clinical interventions, meaning kasama na dyan si psychologist, kasama na dyan si psychiatrist. So in secondary interventions, we tend to lump psychologists and psychiatrists together So the two bars in the middle of that pyramid, that's something that we always want to have in conjunction. So parati silang magkatabi, because psychologists also need psychiatrists to treat some patients. Yeah. So why might that be the case? For example, there's an employee that comes through with a severe mental health condition already. Medicines prescribed by psychiatrists can help as well in terms of lowering down those symptoms, giving immediate relief to the employee, and the psychologist can then provide therapy, the usual cognitive behavioral therapy, etc. Now, if we move up closer to the top of the pyramid, what we believe the final stage of that intervention would be is actually critical incident management. So earlier, I showed you a slide on regular consultations versus emergency consultations. Emergency consultations would fall on this tertiary intervention portion of the pyramid. So this is already when you have, for example, licensed mental health professionals coordinating with your employees on a 24 by 7 basis if they need support to get to a mental health facility, if there's something actual severe that happened. That's something that tertiary interventions also include. So a question might be, okay, so what are we required? What's the minimum that we can provide to our employees to meet certain dollar requirements like the Mental Health Act? Well, what the act just clearly states is to have access to licensed mental health professionals. So that's more on secondary interventions. But something that I'd also want you to consider is it doesn't necessarily mean that you have to pay for your mental health services for your employees, right? There are a lot of free services out there too. That's something that you might want to explore. But the benefits of going with paid services might be that they'll tailor programs more towards your company's objectives. And maybe they can integrate a bit more into your actual systems as an organization. So, those are a few other things to consider whenever you're building your own mental health program. All right. So a question, diba? How does MedGrocer implement mental health services? Well, something that we do in MedGrocer is covering everything from first line interventions all the way to tertiary interventions. So moving from left to right, these four different boxes covers that entire pyramid. So our basic services include things like webinars, assessments for your employee population, and then that works hand in hand with counseling and therapy and psychiatry and medicines. So that's the secondary level of our intervention pyramid, right? So after we do our assessments or after we do webinars, there might be people that approach us for consultations. Then that's when we do our counseling, therapy, and medicine programs as well. And then the last part of the pyramid that we also cover is whenever it comes to emergency response and handling. So these are things nga na are more one-off cases, but these are some things that might be life and death situations as well. I see a comment right now. What would be an example of triage, right? I believe you saw um, uh, that word here in secondary interventions. Good question. Thank you so much for raising that. What we exactly mean by triage is having people, for example, go through a licensed psychologist first before they're escalated to a psychiatrist for medication management. So, an example of what that whole triage ecosystem looks like is an employee, for example, might raise their mental health concern with your company HR, and then your company HR would talk to a service provider, for example, like MedGrocer, and MedGrocer would then assess this situation. Okay, should this person be seen by a psychologist first? Or, for example, should they be seen by a psychiatrist first? So, MedGrocer would then find out which is the most appropriate level of care for that certain employee. And then that's how we triage things. So, hopefully, that clarifies a bit more on what triage exactly means. All right. So, ito na. This is, I think, the burning question inside your minds. No, how much should I spend on my mental health? or on my employees and colleagues' mental health? Well, let's first take a look at how much mental health is costing your company, right? I think earlier, si Coach Darwin, whenever we were discussing the wow quote of the week, talked a bit about how there are studies that say there are certain chronic conditions that are affected by emotions and our mental health. And what the data suggests is this is actually true, no? Depressed and comorbid employees utilize physical health services 2.6 times more. So what does that mean? Yung HMO utilization nyo, your HMO premiums go up because there might be people that are struggling with diabetes at the same time struggling with depression. So those certain factors might be something you'd want to consider. Of course, absenteeism is something that's always on our minds, right? How many employees take a mental health leave in your company? And maybe providing a service for those employees might be cheaper than losing them for 1 to 2 days per year. And if you're thinking, oh, baka 2 days lang naman per employee. But that's exactly the point, no? It's per employee. So you might have a company size of 100 people, and if you're missing 2 days per person per year, you're losing 200 days of productivity from your entire company, right? And another big factor is presenteeism or being unproductive at work. So around 14% of the time is the average for people that are unwell. So what does that mean? In an 8-hour work day, you're losing 1 hour of productivity that can be prevented by enabling mental health support. And of course, if we're taking a look at turnover rates naman, I'm sure yung HR folks natin here in the HR cafe right now can also attest. What employees would usually say whenever they're resigning or leaving the company is, I'm leaving because I'm stressed due to my work, right? That might be something that we can actually prevent with mental health support. And this saves you a lot on training, this saves you a lot on your HR resources, this saves you a lot on having to restructure certain parts of your organization because people are leaving, right? So, how do we set aside this budget, or what budgeting frameworks can we work with? One thing that you might want to consider is to be a percentage of your employee benefits. What employee benefits are we talking about? Ano ba yung breakdown of your SSS, pag-ibig, PhilHealth coverage, and maybe your HMO as well? It's hard to compute that percentage necessarily. Even me, I can't say na this is the exact thing that you'd want to go with. That's a bit harder to do. But something a bit more straightforward might be your percentage of employee salary. So, for example, an employee is earning 300,000 annually. Maybe 1% of that annual salary can already support their mental health needs, right? And that's really the cost of mental health services nowadays. It can be as low as 1 to 2% of annual salary per year. Um, so that's something that I also want you to consider. And for companies that might have HMO coverage already for mental health concerns, maybe there's a percentage of your HMO budget that can go to mental health related concerns, right? Sige. So I think there's still one question or one burning topic in mind. We already went through budgeting frameworks. We already went through the cost of unwellness. But the question still is, how much should we invest? It's a big undertaking to invest in an entirely new program, right? And I think I'd like to wrap up this presentation as well with a quick story. I think we still have some time. Sorry, Coach Darwin, if nag-overtime ako. But as a business person and as a mental health practitioner, advocate, or a mental health ally, one of the highlights that I guess prompted a lot of reflection for me was working with my colleagues that are licensed psychologists and psychiatrists for a specific emergency case that we had last year. So once again, medyo trigger warning lang again. We'll be discussing some pretty heavy topics for this story. Um, so if I recall correctly, it was an afternoon back in October of 2020 when we were first notified of an employee that was having an emergency case. So what the employee did was they left the site without notice. So on site na sila as early as last year. So they left the office. didn't tell anyone where they were going, didn't tell their family where they were going. We reached out multiple times through text and call, right? We weren't receiving a response, which is quite unusual, because for us, we notify people if they're having an emergency that we'll be calling them, and they usually pick up, right? We didn't receive a response from that employee until later that evening. So siguro around 7 or 8 p.m., we received the text. So sinabi niya na parang, oh, medyo pagod ako from work. Pwede ba later na lang kayo tumawag, mga 12 midnight. And for context din kasi, our services function 24/7. So that's also something that we do, right? So sige, we called 12 midnight at the phone number that she provided us. When we called, nagulat kami because yung sumagot ng phone was a random pedestrian on the street. Tumatawid lang ng daan. Kasi yung ginawa ng employee na to, pinamigay niya na lahat, all of her belongings. She gave it to this pedestrian on the street. And that specific employee, that emergency case, they were already on the street just waiting to be hit by a car, right? And I know it's a difficult thing to answer right now, or a difficult story to digest. But even me, I was shocked, right? I started with MedGrocer almost 2 years ago. We started that mental health program too. And then there's me, a young person coming out of college, delivering mental health services. So I was on the phone with our psychologists, our psychiatrists, trying to figure out the best way to handle this case, right? So at that point, it was all hands on deck, right? I would usually not intervene whenever it comes to emergencies, but in this specific case, it was that urgent. So what I was doing, I was calling up hospitals, calling up other organizations that can provide support. But the sad reality of mental health in the Philippines currently is there's not enough supply, and there's not enough room to accommodate these cases. There's not enough capabilities yet whenever it comes to our physical hospitals. Certain hospitals rejected this client from being admitted to the ER, right? Kasi mental health condition siya, ayaw namin i-cover. But this is really a person that can die within the next few hours if we don't do anything about it, right? So fast forward a bit, a few hours. At this point, it's already 3 a.m. We're on the phone with that person, yung pedestrian. Minomonitor niya yung employee. Buti na lang mabait yung person sa kalye, di ba? Well, we never know. Baka umalis lang yung person na yun. But luckily, they were monitoring the situation as well. We were able to get a hold of the barangay, certain local officials that were like, sige, okay, we'll help you with this. We're not trained, but we'll support you in bringing them to barangay hall, just so they have a place to stay. So we're like, okay, sige, at least we'll know that this person is safe. So we're able to get them to the LGU center by around 4 a.m., 5 a.m. in the morning. All of us tired, psychologists, very tired na rin. And it's just making me think, no? The first question na pumasok sa utak ko was, binabayaran ba ako enough to do this, right? Fresh grad at the time, handling this severe of a case. I don't even know the answer to that, right? But the question of how much should a company spend to save this person's life? How do you even value the cost of a life? That's a hard question to answer, right? Even now, almost 2 years later, I still don't know the answer. I'm not sure what that number might be, but what I am sure of is it's not zero, right? The value of that person's life is not zero, and they deserve that mental health support. Okay? So that's it. Hopefully, you were able to sit through that story. And hopefully, it's also made you think about mental health in your workplace. Thank you so much for listening to my presentation. And thank you again, Coach Darwin, for inviting me today. I believe we'll be taking on a few questions next. All right. Thank you so much.
Thank you, Ralph, for that presentation of the importance of mental health in the workplace. Naku, alam mo ba, napakaraming mga employers, even in the past, hindi nila na-recognize yung importance ng mental health or mental health well-being ng mga employees nila
All right.
kung hindi pa nagka-pandemic. 'di ba?
Exactly.
Because of the
Mm-mm.
pandemic, they were a lot of leaders, employers are now more open to
Mm-hmm.
realizing the importance of taking care of the mental health and well-being of their employees.
Right.
Normally, companies will be more focused on the physical health of
Mm-mm.
the employees, diba? They
Mm-mm.
would make sure that they have HMO coverage. They would have health and wellness programs inside their organizations or in the
Mm-hmm.
company. Pero there are very few programs dedicated to mental health and also taking care of your mental health well-being.
Right. Mm-mm.
In fact, there is actually a law
Mm-hmm.
na nagtatakda na dapat each and every company in the Philippines should have a mental health wellness program in the
Mm-hmm.
organization. Now,
Mm-hmm.
merong mga questions dito, Ralph.
Okay, great, great. Mm-mm.
Let's go through the questions. Meron ako kanina rito nakita may nagtanong dito if ano yung sample ng triage. Sabihin,
Mm-hmm.
nawala ah. Ito na lang, ito. Can an employee be terminated due to mental health conditions?
Mm-hmm.
Would you like me to answer this or would you like me to
Sure, sure.
proceed
I
to
I'd love to take this on, and then I think you can also give your input after,
sure.
you know. I guess I'll also provide the advice that we give our clients whenever they ask this question, because we get this a lot. Believe it or not, no. Even if may mental health programs na yung companies na to. The short answer is you can't directly uh, terminate an employee because of a mental health condition. What we say is it's more on the performance on the job itself, because let's remove then the stigma of mental health. Let's look at it from a physical health perspective. If nagkasakit ba yung employee mo, for example, would you then terminate them for being for example COVID positive, or having a serious illness, right? So that answer is quite complicated to answer too. Mm-mm.
Okay. Thank you for that, Ralph. Now, from my end siguro, wearing the HR hat,
Right.
um, tama ka nga, we
Mm-mm.
cannot immediately terminate a
Mm-mm.
person who has mental health issues or mental health problems.
Right.
Una-una, kung HR ka and may nagsabi na ang isang empleyado ay may mental health condition, what you need to do is to make sure that you refer that person to be checked by a professional. And when I
Exactly.
say professional, make sure that the person will be endorsed to a licensed
Mm-hmm.
public psychiatrist
Mm-hmm.
to be able to make an assessment if the person is really clinically diagnosed
Right.
to have mental health issues. Kasi
Mm-hmm.
karaniwan kasi ang nangyayari, may tinatawag na negative branding yung mga
Correct.
fellow
Mm.
employees sa kanilang kapwa employee, yung sinasabi nila, nako may topak yan, nako
Oo.
ano yan, may bipolar
Mm.
issues yan or kaya may tiniling yan, 'di ba?
Mm.
Normally employees themselves get into this name calling
Right.
with regards to people who might have mental health issues or mental health problems. But as an HR person, as an employer, what you need to do is help the employee by endorsing the employee to a licensed psychiatrist and let
Mhm.
that professional be able to make a medical recommendation of the mental state or the mental status of your employee. If the
Correct.
employee can be cured within less than 6 months, then what you need to do is put the employee on a medical sick leave, 'di ba?
Mhm.
Or also you can support the employee by providing him or her endorsement to seek a psychiatrist, a psychologist, or even a life coach para ma-resolve yung mga mental health issues niya, yung mga challenges niya, yung mga concerns niya. Pero
Right.
hindi mo siya pwedeng i-terminate. Kung pwede mo siyang ilagay into a kailangan mo explain sa person na we'll be putting you into a medical leave based on the recommendation of the licensed psychiatrist.
Mhm.
Pero pag sinabi nung psychiatrist na, nako, this person is clinically diagnosed to be, let's say, schizophrenic, or would have a mental illness that cannot be cured in less than 6 months, then what the employer can do is the employer can legally terminate the employee through authorized causes.
Mhm.
Pag sinabi, and with ang gagamitin natin dito ay yung authorized causes with regards to illness. Kasi if it's really an illness, a mental illness that cannot be cured in 6 months period, then you can terminate and just pay separation pay. Pero hindi lang dapat doon nag-end yung yung role ng HR, hindi lang dun sa
Mhm.
pag-terminate sa pag bibigay ng separation pay. As much as possible, if you can help the person be endorsed into a public health clinic, a mental health institution, for the person to be able to be cured. Kasi
Mhm.
yun naman talaga yung goal, di ba? Do not focus on the problem, focus on the solution. Paano pa
Exactly.
natin matutulungan si employee? Di ba?
Mhm.
Hindi yung meron tayong empleyadong baliw. Pero dapat natin matutulungan si employee, di
Yeah.
ba?
Oo, oo.
So
Yeah,
that's
and
it for
oo.
me. You can
Yeah.
terminate, yes, but it's on a condition provided by law that the illness is not curable in more than 6 months.
Mhm. And
So
exactly right. I think ano din one of our other partner companies, or a few of the partner companies that we work with, they also extend post-employment support as well. So dun talaga dumadating yung tulong, right? Even after they're terminated, for example, they still provide that mental health support even outside of the workplace. So hopefully that's something that you guys can consider too.
agree.
Mm-mm.
Another question. This is coming from Mirna Kabantog.
Mm,
Mirna is asking, what are the sample of triage? Di ba sa
got it.
hospital, pag sinabing triage are being classified into the
Right.
level of
Level of care.
severity, di ba, of your
Oo.
condition. What's
Oo.
the sample of triage in terms of mental health,
Sige.
categorizing your mental health condition?
Sure, sure. Sige, I'd love to give a sample. So siguro let's use Coach Darwin then for this example, right? For example, si Coach Darwin may life coaching client siya, and then Coach Darwin also probably has a network of psychologists and psychiatrists at his disposal. If Coach Darwin would see na there's a possible clinical condition in that specific client, what he would then do is refer this person to a licensed psychologist or psychiatrist. If sa tingin ni Coach Darwin na, okay, sige, baka kaya pa tong i-therapy, maybe we'd go with a licensed psychologist first. And then once this client reaches this licensed psychologist, and then nag-assess si licensed psychologist na, oh, there might be something a bit deeper here. Maybe medication can help. Then magre-refer si licensed psychologist to licensed psychiatrist, where they can get medication, they can get that extra need for support through that psychiatrist. And if ever there's a case talaga, they would then be referred to a mental health facility for inpatient support. But something that's important here, the example that I gave just now is something that happens in the real world, no? Something na more of ikaw mismo naghanap ng mental health support outside of your employer or outside of a single service. But there are services that have that entire triage or entire triage system already in place. So they do all of that referrals for you. There's no need to go outside. It's like you went into a hospital, pumunta ka sa ER, nakakita ka ng nurse, tiningnan ka ng doktor, nag-x-ray ka, bali yung buto mo, nakakuha ka ng gamot, and then now you're okay. So hopefully that's something that we can also build, no? That triage system.
Okay, another question that phone-in question that we have is,
Mm.
how often should a mental health program be in place in companies or in organizations? Kano
Mm.
ba kadalas dapat may mental health program
Mm-hmm.
na sinasagawa
Oo.
sa isang kumpanya?
Mm-hmm. So, gaano ba kadalas depends on ano ba yung sinusubukan nating gawin, right? Gusto ba nating more psychoeducational, meaning ginagawa lang natin aware yung employees natin on mental health, then maybe that's something that we can do once every quarter. Papa-webinar tayo, will build people's understanding on mental health. But if we need to go one level deeper, meaning gusto na natin may consultations, for example, with psychologists, yung individual employees, this might be something na you'd have one consultation a month and then may follow-ups ka moving forward. But for an entire employee population, I think where companies should start is really a mental health policy. No, and I think dun rin in line with DOLE amendments, no, is creating that mental health policy first. Oo.
Another phone-in question, Ralph,
Mm,
that I have is that
sure.
um, with regards to the mental health programs that
Mm,
companies are providing, di ba? It depends on how often they decide, di ba?
right.
But yung sa mental health programs ba, who should lead it? Should it be
Mm-hmm.
led by HR or should it be led by their functional leaders or department
Mm-hmm.
heads?
Right. Um, I think this is also an it depends question. No, it depends how involved your HR is whenever it comes to operations. So, for example, the service that you're providing, probably as a BPO service, for example, your HR is very involved since technically your product is also your people, right? It's the people that are servicing certain clients, right? So maybe in that case, HR should be a bit more involved whenever initiating a program. But if we're talking something na more operationally directed, yung company nyo, then maybe operations should be involved as well whenever it comes to the mental health program.
Another question, Ralph, would be is there a specific age or
Mm-hmm.
generation that
Mm-hmm.
mental health illness is more prone to happen? Kasi 'di
Right,
ba,
right,
I've been reading a
right.
lot of comments from different groups na mas prone daw ang mga Generation Y or Generation X or yung mga
Mm-hmm.
millennials with regards to mental health illness. Kasi nung panahon namin,
Mm,
and this is
right.
being true, nung
Yeah.
kapanahon na namin, pag sinabing mental health, this is something that you should be able to um,
Parang laban lang,
resolve
kakayanin. Oo.
resolve within
Mm-mm.
yourself or resolve within your family. Diba?
Right.
It's a
Oo.
taboo to actually
Right.
discuss mental health outside family. Diba? At
Mm,
the expectation din is kung meron kang mental health issues, you have to resolve it by yourself. Diba?
mm.
Kasi if you're not able to resolve it with yourself, then that's a time that you are being categorized as someone who has
Oo, parang
mental
tinotopak ka
health
na, baliw ka na. Oo. Oo.
issues. Kumbaga, kailangan ka ng i-check in sa isang mental
Right.
health institutions. So
Right.
is there a truth that there are specific age group or generation that is prone to mental health issues? Kasi kanina
Got it.
sinasabi mo na na based on your current
Mm.
data, LGBTQs people are high
Mm.
in terms of uh, concerns in mental
Mm.
health, pati na rin yung mga females natin, yung mga female
Mm.
employees natin, they're more prone into mental health issues. But
Mm.
aside from that demography, is there a certain demography in terms of age that
Mm.
are prone to mental health illness?
Mhm. So, I think I'd like to again draw a parallel sa ano no, physical health. Before for example, pag nagkaubo ka, siguro back in the 1800s or 90s, sige, ilagundi mo lang yan. You'll get better. And it might take you 1 to 2 weeks to get better with that intervention, trying to take care of your cough alone. But then, sige, pumasok si modern medicine. Meron ka ng Ascof, meron ka ng mga other medicines that you can use for a cough. And then you can get better in 1 to 3 days. Mawawala na yung ubo mo. I think that's something that we also need to make a standard whenever it comes to mental health. It might be something that you can work through. For example, there are people with depression that were able to get over their depression um, by themselves, but it might have taken them years to get over their depression or to be able to combat their mental illness. But then, with the help of professionals and possibly with the help of medication, you can get better much faster, right? So that's one thing to consider. Now, if we're talking about age, I think part of it is also stigma, right? Mental health has been stigmatized for the longest time. Yun nga, we throw out these labels na, sige, baliw lang yung person na to, may topak, tinutoyo, example, right? Because we don't accept it as something that's valid, right? And especially the older generation, and this is also studied as well, they're less open to seeking mental health support, even if they do need it. Because yung belief na nga nila is it's something mental. Kaya ko to deal with alone. But there are some people that deal with mental illness their whole lives. And before they find out na I can get this support pala, um, their lives suddenly change. Like there are some people that might start antidepressants, and then they'll start to do things they've never considered they could do before, right? May mga success stories na kami previously na they've already gotten better, they've already went through their mental health condition, and they're now functioning properly at work. And even the most severe conditions, people with schizophrenia, for example, people that are hearing voices, if you treat that medically and with medicines, assuming na humihiyang pa yung medicine na yun sa kanila, they can go back to normal and live a relatively normal life, right? So let's remove that age stigma. It's true that more millennials, more Gen Z reach out for mental health support, but that's also because these people are more aware that they have access to these services. Na it's not something to be ashamed of. Don't be ashamed of the emotional pain that you're going through. Make it something that you can talk about, either with your friends, family, or a professional if you think that's what you need.
Well, there's one last question for you,
Sure,
Ralph. This
sure.
is coming from Raphael Chua. How can
Okay.
we encourage employees to seek mental health support despite existing stigma against
Right.
it?
Right. I love this question talaga, especially whenever it's in the workplace, because it really starts with the leaders. Eh. And I think you can also attest to this, Coach Darwin, no? As a people leader yourself and as a life coach. It's different when your top leaders in a company are so open about discussing mental health concerns. Employees won't feel like they're being attacked or they're being cordoned off from the rest of the population just because they're doing something or having something that they're going through. Diba? Make it something more normalized, an open discussion between you and your employees. I think that's the biggest factor that we can do. And of course, encourage people through collaterals, webinars, etc. Start that conversation on your end as an employer.
One last question. May pahabol sa iyo, Ralph. This is
Sure.
coming from Judy Ann Martinez. Good afternoon, mentors. Asking for your advice on how can we help as HR to initiate the Mental Wellness Leave Act. Ito yung sinasabi ko sa inyong batas
Mm-mm.
na nagsasabi na kailangan each and every company should have a mental
Mental health
health
leave. Mm-mm.
uh, process or program in place.
Mm-hmm. Right. I think the best thing to do is to start with data, to start with numbers. Alam naman natin when we're talking to leaders, especially ops or finance, what will our company get from initiating this policy? And then maybe you can do a bit more research internally. How many of our employees have left, for example, due to stress? How many people are saying that their home lives might be a bit difficult? It's hard for them to come to work, and then maybe you can calculate what those costs are with your company and how much a mental health program costs to initiate, because it really doesn't cost that much. You can start internally for zero cost at all the way to, I don't know, maybe 3% of yun nga, annual salary ng employees nyo, and that's already end-to-end coverage. You're already there with tertiary interventions, having emergencies covered, having counseling covered. But I really do believe you need to make a case for your company to cover this by showing leaders what your people are going through. Make it a story about your people, backed by data, of course.
Agree, agree.
Mm-hmm.
Mental health is something that each in every company should work on and focus on. It's not because it's not only mandated by law, but
Mm-hmm.
also it's a way for us to be able to ensure that our employees are at the peak of their health.
Right.
Remember, the mental health of your employees affects their physical health and also their productivity. If their
Mm-hmm.
productivity is affected, then the productivity of the company is generally affected,
Mm-hmm.
right?
Right.
So, any last words, Ralph,
Mm-hmm.
to our audience and listeners? I'm sure a lot of more people will be watching this
Mm-hmm.
episode through their team replay. Marami kasi tayo
Mm-hmm.
mga team replay, yung mga
Yeah.
na,
Yeah.
na
Uh-oh.
nanonood at nakikinig after ng program, or they tune in and watch it in YouTube or at the HR Cafe FB page. So, what are your last words or anything that you would like to share to our audience today?
Sure, sure. I guess for last words, I just want to re-emphasize how important people are to businesses, to our organizations. If it weren't for the people that we're working with, the success of the company cannot follow. So if we take care of our people, we take care of our organization, we take care of the company, we take care of the bottom line. It all starts with taking care of people. So yeah, those are my last words for our listeners today.
Well, thank you. Maraming salamat, Mr. Raphael Santos
Thank you so
of
much.
MedGrocer. And again, ladies and gentlemen, we're wrapping up another program, another episode of our program, HR Cafe, Usapang Trabaho, Buhay, Iba Pa. We'll see you again next week for another free learning and free training activities here at your weekly weekend learning program. Usapang Trabaho, Buhay Iba Pa, HR Cafe. Bye everyone. God
Bye
bless.
everyone. Have a good Sunday.
Have a good Sunday.